welcome to the 6th general meeting. As people continue to enter the room, definitely fill out that poll just so we can see how you guys are doing. But I hope everyone's doing well. We have a great speaker and AMSA update lineup for you guys today. So without further ado, we'll go ahead and get started.
All right, so the semester is coming to kind of getting close to the end, and we just want to make sure that as many of you guys as possible can reach that active status. So if you need to earn some quick points to get yourself to the active status, be sure to check the Easy Points doc, which is found on our website under the member resources page. It has a lot of different easy opportunities for you guys to get those points that you need.
All right, and again, I plugged this in the Discord chat earlier, but our officer applications are due tonight at 11:59. So definitely submit those a few minutes, if not a couple of hours early, just because we don't want any technical difficulties to void your application. They're due tonight at midnight, so please send those in. We really encourage everyone to apply. You don't have to, please don't think that you have to have been an officer assistant, a previous officer, or even super involved. We just appreciate all of y'all's passion, dedication, and great ideas. So please, again, apply, ask us questions. I really cannot emphasize how great AMSA leadership is enough. But in any case, we will have officer elections next GM. So we are officially in election season. So look forward to a lot of changes happening. Yeah, we can go on to the next slide. Yep.
Okay. So just some quick AMSA updates for you guys. I sent y'all an email today. I hope you guys got it. And that was plugging the registration info session. That'll be this Sunday. So definitely sign up for that if you're able to. Aside from that, keep in mind April is double points month. So keep on meeting up and let's make it to the end of the semester.
Okay, cool. So yeah, make sure to check out our website and also make sure to check out the member resources page that has a lot of documents you may need for volunteering, shadowing, and then also you can get information for applying to be an officer in case you either haven't started yet or need the docs for that. And then also I thought I'd just explain I included a picture of the Queen because whenever I opened up the sign up sheet for camping, it was like a battle to the death. And so, yeah, I was just watching y'all fight. So anyways, yeah, that's all I wanted to say.
All right, really quickly, the first 3 events are already filled up. So this is just a reminder for those of you who are signed up to attend those events and look out for the event reminder emails. For camping specifically, please do remember to send us your PCT or COVID negative test 3 days prior to Saturday in order to be able to attend.
And the next 3 events, Cookies and Coloring, is held by our wonderful OA, Caitlin. That sign up sheet is full, but there's some spots on the wait list if you're interested. Kayaking on Lady Bird Lake, that is opening up this Saturday. So if you're interested in kayaking, definitely sign up for that. And I'm going to plug our IMSA and volleyball games. They'll be every Sunday from 7 to 8 p.m. And if you're looking to just hang out and maybe play some volleyball with us after, you can come out and get a bonus point for that.
Hi, everyone. These are the upcoming events, but I really just wanted to plug specifically the interview workshop that Armand and I are hosting with our wonderful alumni next week. Technically, the sheet would have opened up tomorrow, but it actually opened up 2 weeks early for the one-on-one interview spots. So that's already halfway full, with it being about halfway full with it already opening up. So go right now and go take advantage of that really amazing opportunity to practice a medical school interview with a med student or future med student. Yeah, hop on that. And then as always, check out all the other programs and resources on the website.
Okay, so we're back. Did we skip one?
Sorry,
Okay.
Oh my God, my bad, sorry.
No worries. All right, volunteering is back. So the first 2 events are here, Meals on Wheels, which our wonderful OA Joyce is running. is already full. CTFB is also full. But yeah, for those events, we just want to remind you, if you are signed up, make sure you show up on time because they are early in the morning. And then after that, we have volunteering with Micah 6, which is the food pantry in West Campus. So if you're on campus or in West Campus, this will be a great one to go to without having to drive. And it'll be opening up in a couple of days. And then again, we have take-home toiletry bag making with Joyce on the 18th.
Yeah, as for virtual events, we've had a lot of fun hosting these this past semester. Upcoming tomorrow, we have Dell Children's recording session. And then after that, Adopt a Nursing Home will be on the 17th. So make sure to sign up for that, especially if you're like in need of some points. And finally, do remember that free rice is always an option for you guys to get 2 volunteering points. It's a really, really easy 2 volunteering points. The sign-up sheet, you can find it on May 1st for the calendar. So basically, as long as you get 50 questions in before May 1st on 11:59 p.m., you'll be good to go. You'll get your 2 points, and then that'll be really easy for, especially for those of you who are virtual. Another thing, don't forget that if you don't have enough volunteering points to be active, you can always go to the clinical and non-clinical volunteering databases, and then, or just do some outside volunteering and submit that form.
So for public relations, if you're in need of another makeup or meeting point, you can come out to one of the makeup meetings. They're every other Thursday. If you did fill out the merch pickup form for shipping, then those will be sent out tomorrow and they should arrive within the next week. If you're in need of some last minute bonus points, you can also follow us on all of our social media platforms. And then last but not least, the merch store is still up and running. So if you're interested in buying some old merch, you can go on that website and purchase them for pretty low price.
All right, hey guys. So within the next 2 weeks, we have our social media challenge and rockathon coming up, which I'll break down more in the next slide. And just wanted to mention that we have one more scheduled PCC bucking event on the 24th in the evening time. So sign up once the sign up sheet opens. So the social media challenge is going to be like a 1-week campaign. You guys are actually given the opportunity to host your own fundraising campaign for American Lung Association. So that's going to be the philanthropy we're going to be donating to. And so we'll give you guys specific protocols, which will be posted on the announcements, and you guys are given the option to do whatever you guys want, whether it's like the dares or doing the bingo cards on Instagram, etc. And from previous experience from doing this last year, I would say it's like a lot of fun. It's very engaging, and so I highly encourage it. And for the rockathon, it's going to be like our final push on the last day, where we have like a 12-hour Zoom call and just try to encourage others to join the call, stay on the call as long as possible based on the donations. And we're going to be starting off with our Armand's alumni-led gaming tournament. And if Armand wants to elaborate more on that, he can right now.
Yeah, really quickly, I'll talk about it. It's going to be led by, there's going to be 8 teams of 4 each, and each team is going to be led by an alumni or a current senior, like Daniel, DT, and Carissa. And so this is going to be a lot of fun, and it's going to be kicking off the rockathon. So I really encourage you guys to sign up. The sign up sheet opens this Saturday.
All right, and just real quick, it's not in there, but the Rockathon live stream will also be where everyone can pie me in the face for donating this week through AED's Pie Present. So I know some of y'all have been submitting donations. My face is already trembling in fear, but that's okay because it's all for a good cause. Last few reminders, definitely do try to reach active status. There's lots of benefits, especially for gold and silver. But we really just want to see you guys utilize the resources that all of the officers have worked really hard to put out for you guys. Again, I want to emphasize the officer applications. A lot of things will be happening in the next couple of months. So definitely stay up to date with what's happening in AMSA, whether that's through the newsletter, Discord, or our social media. And again, the 7th general meeting will be the election night. So applicants will be giving very brief speeches, and we'll have some really quick presentations. So no real AMSA updates then. It'll just be kind of dedicated to elections, and that is really important for all of you guys to attend so that you can have a say in who is representing you next year. Obviously, these elections are only available to people who are currently paid. So even though we have kept our general meetings kind of open to anyone. At this particular election night, you can only vote if you are a currently paid member. So just keep that in mind. But otherwise, we'll send out obviously reminders about events through Discord and email as we've been doing all semester. But with that being said, we'll go ahead and transition to our guest speaker.
Awesome. So yeah, I'll go ahead and introduce our two guest speakers actually for today. If you go to the next slide, Daniel, please, everyone welcome Dr. Kwan and Dr. Riley. They will be speaking to us today. And I'll go ahead and hand it over to y'all.
Can y'all hear us?
Yes.
Can you hear us? Okay. Can you guys see the screen?
No.
We cannot. Dr. Kwong, you should have co-host privileges, but let me know if there's another account that needs them.
There we go. Is that better? Oh, which slide are you on? You're on the first slide. All right, I think they can see it. Y'all get, does it look like we're there now? Cool, awesome. Well, my name is Chris Riley, and this is Eddie Kwan, and we're both about to graduate. So we're in our third year of dermatology residency, and we're both at the San Antonio Uniformed Services Health Education Consortium, or the military program down in San Antonio in the dermatology department. Just real quickly, we have to say this, we have no disclaimers, and these are our own views and not the government's.
So just a quick slide on the stuff we'll go through today. We'll talk about our pathway to medicine. We'll talk in general what the overview of dermatology is like and like residency life. And we'll finish off with a couple quick case presentations and a couple minutes on military medicine and military dermatology and what our role is. And then we'll finish off with some questions at the end.
So as far as our pathway to medicine, we're just going to talk real briefly about where we came from. And then we were both on, we served on the admissions committee for both of our medical schools respectively. So we can talk a little bit about what we thought was important for our own applications, as well as for, people that we were reviewing their applications or interviewing. But really briefly, I grew up in Central Florida, close to Daytona Beach, in a small town called DeLand, Florida. I went to a small liberal arts, very small private university called Stetson University. They're close by, or in Central Florida as well. I was a molecular biology and major and chemistry minor. And then I applied to medical school and was accepted and went to the Virginia Commonwealth University School of Medicine, or Medical College of Virginia in Richmond, Virginia. And then throughout the whole, when I was accepted, I applied for the HPSB, or the Health Profession Scholarship Program. So that's kind of where I started my Army career. And then after I graduated from medical school, I started my active duty career by doing an internship here in San Antonio for 1 year, followed by 3 years of dermatology. And then next year, or not next year, but this summer when I graduate, so like the next academic year, I'll be moving to Augusta, Georgia, or Fort Gordon, to start my career as an attending or staff dermatologist.
So I grew up in Tucson, Arizona. I went to the University of Arizona for my undergraduate degree, and I studied MCB, or molecular and cellular biology, and physiology. Afterwards, I went to USIS, which is the military medical school in Bethesda, Maryland. And same as Chris, after graduation, I did an internship here in San Antonio for 1 year through the transitional year program, and finishing up my third year of dermatology residency. In July, I'll be moving to Korea for a couple of years to practice dermatology out there.
So I think the biggest key to success for anybody applying to either medical school or applying to residency is to make sure that your application or your resume is very well rounded. The main, goals or the main items that, I was thinking about when I was applying to medical school, or what I was looking at when I was reviewing applications for those that were applying to VCU, were kind of here, like grades and board scores or MCAT scores, research experience, volunteering, and clinical experience. And I think the best thing is to really show a dedication over an extended period of time as well. So whatever your passion is or whatever you want to follow, like, I think that, showing that dedication and commitment to, like, one, not necessarily one thing, but a handful of things goes a long way, rather than like just volunteering for an hour here and shadowing with one doctor for a day or two there, but really sticking to something for commitment. So we don't really have to go into grades a lot. Like, we all know that if you want to get into medical school, and if you want to do well in medical school and get into a good residency, that you just always have to do your best to study hard and do well. So I'm sure everybody here is doing their best on that. I'll talk about what I did for these other three, and then Eddie can talk for a minute about what he did. So my school is a very small school, so I had opportunities early on in undergraduate work to kind of get to know a lot of my professors. I mean, I think my smallest class was a neuroscience class. I had 6 people in it, so it's pretty easy to get to know your professor. But early on, so in between my first and second year of undergraduate studies, I got involved in a research project in neurogustatory or taste behavior of rats, and just kind of stayed with that for 3 years. Had a couple local, regional presentations, as well as a couple national poster presentations, and then finally like a first author publication with that. But just getting involved with a research mentor or project, like a team that's working on various projects and sticking with it through time, can really lend itself to a lot of good opportunities. As far as volunteering, I kind of stuck with some things that I started both in high school and continued on through college, and a few other things that I started in college. A few after school activities for elementary age students and middle-aged students. None of it was medically based, but just kind of giving back to my local community, and then working with a church ministry that I've been a part of from high school, just working in nursing homes. Just continuing on with that were kind of 2 big things that I was able to show that I'd stuck with on a weekly basis for like years of my life. And then as far as clinical experience, I mean, there's a lot of people that applied. They were, EMTs, or they were paramedics, or they were prior service military, and they were medics in the military. You feel like it's hard to compete with those people as far as their clinical experience. But it's best just to do what you can. I volunteered at the local hospital, and then also like had an orthopedic surgeon and a general surgeon that I just shadowed as much as I could over an extended period of time. So those were kind of some of the big ways that I hit some of those major aspects of things that people are looking for.
So for me, at the U of A, I did 2 research projects. I worked in a wet lab where I did basic science research for cancer biology for a couple of years during my junior and senior year of undergrad. And then afterwards, I volunteered at a small company doing electrophysiology, trying to develop a cost-effective way of developing a gel foam that allowed us to deliver medications for a very cheap price, so 5 cents versus like several dollars to find like a mechanical pump. In terms of volunteering, I did some volunteering for a hospital. I was a certified pharmacy technician, so I used that to volunteer at the pharmacy once or twice a week. I was also EMT certified, so I volunteered for the school like EMT, like volunteer EMT service as well. And then I also shadowed a family medicine and internal medicine doctor on Fridays or Thursdays, depending on the week.
And then all these things, as well as, where you came from, what shaped you as a person, as a kid, as a college student, et cetera. And as well as these experiences that I'm sure a lot of you have similar ones to, kind of shape your overall application and kind of help you tailor your personal statement or that you'll submit to with your application. And that's what we were talking last night. We had another similar meeting where we gave the same lecture, and they're asking us some questions, is like, what was the kind of the more challenging aspect of applying? And we both thought that, writing a personal statement that is going to be different than everybody else's, that doesn't sound cheesy, and really kind of details you as an individual, can be very challenging. So just think about what makes you different from other people, and then also having a few other people read it. One thing that I mentioned is like not having too many like cooks in the kitchen, maybe only having like a handful if you get, too many people to read it, everybody has different writing styles, different ideas, but all these sorts of things and how each of y'all, grew up and the experience that you've had through your life, really think about that for a long time. Start your personal statement early, and have a few people kind of help look over it and make sure that it says what you want it to say.
So we heard you guys kind of talking about interviews and like the questions that they ask and like doing like practice interviews with people or as part of like a conference or event. So we both did admissions committee during our 3rd or 4th year of medical school. So we interviewed anywhere between like 18 to 24 medical students over like a couple months. And some of the major questions that they asked us were obviously like why you want to do medicine or why you're choosing this career field. Some common things that they wanted us to ask were instances where you demonstrated any like ethical responsibility, and to talk about your weaknesses and how you overcome that. Any times that you've demonstrated like leadership qualities or communication or like some type of team building skills. So they won't ask you that directly. It'll just be some indirect question that'll lead to one of these types of questions. So next we'll just go over what dermatology is as a whole. So we'll talk about the scope, we'll talk about our life in residency, any research, and then fellowship opportunities afterwards.
Slide. As far as like the pathway into any sort of residency program, it's pretty similar, is to getting into a good college and to getting into a medical school. It's about making your application resume as well-rounded as possible and as best tailored to that specialty as possible. So when you figure out that you want to do internal medicine or orthopedic surgery or internal medicine or family medicine or whatever, just try your best to get plugged in with residents or attendings in those fields of expertise, and kind of get their input and how to best go about that. But we're going to talk a little bit about our role as a dermatologist in general. Should we go to the next one?
Yeah. So the scope of dermatology, it's really not just treating acne or doing like cosmetic treatments, contrary to popular belief. So this is a very well-rounded specialty. We do a lot of different things in medicine, surgery, pathology, as well as cosmetics. So we do a lot of surgeries. So we normally treat things that we do biopsies on, such as like skin cancers or even like benign things like cysts. And a great thing about dermatology is there's a lot of conditions in medicine that have a skin or cutaneous manifestation. So we can play a large role in helping the internal medicine physicians help diagnose certain things or help them treating these patients. We are also trained to read our own pathology slides. So anything that we biopsy or cut out, we can read that on our own and make sure that that's the correct diagnosis and correlate it with what it looks like clinically. And a good part of it is cosmetic procedures. So at our program, we learn how to do Botox treatments. We can do fillers. We do chemical peels. And some programs do sclerotherapy as well as like hair transplants as well. We have a big laser program here. So lasers can be used for both cosmetic treatments, such as for scars or like discoloration of the skin, or can be used like therapeutically. So for instance, at our institution, we have a lot of wounded warriors that come through that are amputees from like a blast injury or something that causes like loss of a limb. So when they get fitted for a prosthetic, sometimes there's a lot of friction or sweating from like the hair and the sweat glands down in those extremities. So what we can do to help them is do Botox injections to stop the sweating and do laser hair removal on those extremities. So to decrease the friction and the maceration when they're wearing their prosthetic. So a lot of this can help wounded warriors and other people as well. So it's not just all cosmetics. And then after you're done with residency, I mean, there's a lot of different things you could do. You can go into academic dermatology, work at a university, and teach other residents or medical students. You can do private practice dermatology, and in some cases you can consider doing like humanitarian missions, but probably less likely unless you're in the military where they allow that or where it's more common.
I think it's just to kind of reiterate something that Eddie said a minute ago, as far as there's a lot of external manifestations of systemic disease. And I feel like that's what really is where I feel like I'm the most useful. A lot of my colleagues and a lot of my good friends that are in internal medicine, things like that, they know so much more about cardiology, pulmonology, nephrology, all the major internal organ systems, than we do with their extended training. But when it comes to the skin, most people, you'd think it'd be pretty well versed, but people really don't have a good idea of what's going on when it comes to the skin, because there are just so many different ways that things can present. So it's a really cool way to be part of an interdisciplinary team, especially when it comes to these more complex medical patients, and being able to like come in and help make a diagnosis and develop a good treatment plan. So like Eddie was saying, it's not all acne and Botox. Most of what we do is coming up with diagnoses of complex medicine, coming up with good treatment algorithms, and also like diagnosing and managing cancer. And like being in the military, we get a great opportunity, like you said, to treat wounded warriors and people that have been wounded downrange and stuff like that. So it's pretty cool too. Pretty good aspect of dermatology that we get to work with.
So this next slide just kind of goes over like your board scores and the average that it was needed to get into these in 2019 on the left column, and then on the right 4 columns is just the means to get into these specialties for a military type match. You guys are probably thinking about step 1 or step 2 yet, but to put into perspective, the passing score, I think in 2019 was around 192, and the average that year was about 230, 235.
Yeah, I would have had no idea what these numbers meant when I was in college. So.
And it's about the same for both a military or civilian match.
So we'll take a few minutes next to just kind of talk about I guess we'll talk about like just what to expect in medical school. It's another thing, like I didn't really have a great idea either when I was going through college as far as what it was like, until I kind of got more towards the end. But so very briefly, the first 3 or 4 semesters, so my program at VCU was 3 semesters of core classwork. So we were learning your basic science, kind of redoing some biochemistry, anatomy. You're learning about the organ systems and like the disease and manifestations of the various organ systems. And you're just in the classroom the vast majority of the time, with a few other courses in like medical ethics and population health and statistics, and just the initial practice of clinical medicine, like how to use a stethoscope or how to do like a musculoskeletal exam or something like that. So that was the first 3 to 4 semesters. Then you studied for and took the first set of medical licensing exams. So USMLE step 1 for the allopathic or MD schools. And then after that, you finish the rest of your career with more of a clinical rotation. So you have your core rotations like internal medicine, general surgery, psychiatry, pediatrics, et cetera. And then also some time for elective with some more subspecialized areas of expertise. So you do that for your 3rd year. Then you take your second set of medical licensing exam, like in between your 3rd and 4th year. At that point, hopefully you figured out what you want to do with your life, have figured out what you want to apply for as far as residency, and then you can start doing your interview rotations in these sorts in whatever specialty that you are interested in. So for us, that was dermatology. So I did a dermatology rotation at VCU, then I did a dermatology rotation here in San Antonio. So you can do some away ones to kind of interview at various institutions that you may apply to. And then that kind of wraps up most of your last or 4th year of medical school. So that's a very brief rundown. So then after that, for dermatology, it does not have its own integrated internship, or that first year to where you become a general practitioner by completing an accredited internship, taking your final step 3 of the licensing exams. Then you have your full-fledged medical license and practice general medicine after completing an internship. So because dermatology doesn't have its own, you have to do some sort of preliminary intern year, preliminary postgraduate year training. There are various options. So in the civilian world, you can do an internship in internal medicine. You can do an internship in general surgery, or less commonly, an internship in like pediatrics. And another option is a transitional year, which is a very broad, a very well-rounded internship with like a lot of rotations in internal medicine, in surgery, in pediatrics, and a lot of different things, which is what we both did for the Army, because that's the only thing that was offered if you are accepted into dermatology. So as far as residency, there's a lot of different, like most of what you're seeing is just patients in the clinic that are coming in and referred for dermatologic complaints. So whether that's they have lupus or dermatomyositis or acne or a history of skin cancer or a family member with melanoma, it could be who knows what, a combination of a whole bunch of different things. You're seeing those patients and trying to figure out what's going on and treating them. We also have a few other rotations that we did throughout the year. So we do have, like Eddie was mentioning, and kind of especially with our association with the military and treating those wounded warrior scar patients, amputees, et cetera. We do have a very robust laser clinic. So we have some options or opportunities to do like cosmetic and laser procedure rotations. There's a lot of very specific like phototherapy options for dermatology that we do get to work with. And as we get into our second and third year, we get into a little bit of more subspecialized stuff. So we still do some more general dermatology. We also do something called Mohs surgery, which is a specialized way to treat skin cancer, where it can be, you can cut out, look at under the microscope, and repair or sew together any defects that you make. So it's a way to treat high risk or skin cancers on sensitive areas like the head and neck, the hands, the feet, etc. So it's one of the fellowships or subspecialties within dermatology. We also do a rotation at UT Southwestern in Dallas in more inpatient complex medical dermatology. And then we have other rotations in like specific like pediatric dermatology with specialty trained dermatologists, dermatopathology, where we're working with pathologists to help fine tune our diagnostic skills under a microscope, and then a few different electives that we have. So that kind of is a very brief overview of what our 3 years of dermatology look like. And most of this, which is very nice, is Monday through Friday. We're probably working between 40 and 60 hours a week in the clinic with the patients, writing notes, et cetera. But you don't learn hardly any dermatology in medical school. So it's kind of starting from scratch as far as a whole other language and whole other subset of stuff that you've never learned before. So it's a lot of book learning. It's a lot of reading textbooks, going through review PowerPoints, et cetera. So the first year is pretty rough in that sense. And then once you go over it a few times, it gets a little bit easier as it goes along. We're probably on call like over the weekend, like with a pager on, probably about 5 or 6 times, 5 or 6 weekends a year, because we share with all of our co-residents.
So he kind of went over like the broad or general overview of what we do over like 3 years, but every week, this is kind of what our schedule looks like. So every day, Monday to Thursday, we have a lecture for an hour from 7:30 to 8:30. Afterwards, we see whatever rotation that we're on. And then Friday afternoons for 3 hours, we have some type of in-service where we do procedure demonstrations or lectures for 3 hours. Every week, we have a half day of surgery for any skin cancers that we diagnose or any benign things that people are having trouble with, so that we can remove those. We have a half day where we sit with a dermatopathologist where we go over slides and read pathology slides, and a half day of your own personal follow-up. So this is where you can see patients that have more complicated history where you need to spend more time with, or if you want to do some type of cosmetic or procedure, this is where you would see that person. And the rest of the week depends on what rotation you're on. So you can look at more slides. With a dermatopathologist, you can do Mohs surgery all day, every day, the whole week. Or you can do an elective block where you're doing either cosmetics, lasers, or complex medical dermatology. And like you said, Dr. Riley said before, we have every weekend off, we have all the holidays off, and we're on call about 5 or 6 weekends a year, depending on how many people are in your class.
So other things, so we just started a new set of like licensing or board certification for dermatology. So previously you just took a few like practice exams throughout the course of your 3 years, then took a final certification exam or board certification exam after like the summer after you graduated, or the summer that you did graduate. But our class, so class of 2021 was the first year that they've implemented this new board certification regimen. So we do have to take these tests that we have to pass throughout the entire year of our residency, which is good because it kind of keeps you on your toes, keeps you studying and up to date with things. So you do have to pass like a very basic dermatology exam within your first year. And then we have our 4 like core areas of learning or academics. So general dermatology, pediatric dermatology, surgical dermatology, and then dermatopathology, or like diagnosis of dermatology under a microscope. So we have 4 individual core examinations that you have to pass over the course of your second and third year as a resident before you can sit for your final applied or certifying exam, which we'll both be taking in July. It's very nice. I think our program itself, and I think many programs are similar to ours, have a pretty rigorous academic calendar. Every day we're in lecture, every Friday afternoon we're in lecture. But there's a lot of things that the way I've kind of talked about some people that I knew, like underclassmen in medical school and stuff, like the difference between dermatology and other things, like throughout all of medical school and your clerkships in the 3rd and 4th year, it's kind of preparing you to be a general, like a general surgeon or an internal medicine doctor or pediatrician, because you're learning like generally about all the different organ systems. But coming into dermatology, you're diving deep into this one specific organ system from the very beginning. So there's a very steep learning curve. So a lot of studying, a lot of book learning and stuff that you have to do on top of your like daily, work life. It does keep you busy, even though that, we might not be working quite as much as like a surgeon or something like that. They're in their residency programs. But despite all that, we do have time to have a life outside of our clinic or the hospital. Here is from a picture where I took a trip to Las Vegas to meet a friend of mine from internship. Played a lot of golf, didn't go to a lot of casinos because of COVID and everything like that, but we do have some opportunities to have some good times as well.
So during medical school, I had a lot of free time to travel basically around the world. I was able to do rotations in Spain and Portugal, and that's on the right is a picture of Gibraltar. I also went to Ireland for a couple of weeks for a quick rotation, and this is the Cliffs of Moher. During my internship, my transitional year, I was able to go to Korea and Japan for about 4 weeks. And then I finished off my first year of residency, going to Mount Kilimanjaro in Africa. So there's a lot of free time. I would definitely take time for like personal well-being or like just hanging out with friends and family. And dermatology definitely allows you enough time to do all of that.
So as far as, once you come out of dermatology residency, you should be, well suited to practice just general dermatology, kind of encompassing the scope that we've gone over the last few minutes. There are a few like very more specific trainings, which is called fellowships, which are subspecialties within an individual specialty that you can complete after you finish residency. The 3 main ones for dermatology are going to be Mohs surgery, which I discussed. It's like a way to treat cancer and map it out in real time. And they're also basically to some degree like plastic surgeons, because they're trained in advanced repairs of the skin with flaps, tissue grafts, and that's who I would want cutting on my face if I needed to. Pediatric dermatology, so I mean that's pretty obvious. So, but you're going for an additional year of training specifically in complex disease of children that presents with skin conditions. Dermatopathology, which is becoming an expert in the diagnosis of skin disease by reading under the microscope. Those are the 3 main ones that are the vast majority of people would go into. There are numerous other ones, usually maybe just 1 or 2 programs in the nation or world, but can be very specific to laser procedures, cosmetics, maybe complex medical dermatology at some bigger institutions. Some people specialize specifically in like lymphomas of the skin or other sort of cancer issues, or like such as melanoma. So there are even though dermatology on itself is a subspecialty, you can get, it's pretty cool because there's still a lot of other even more detailed options that you can go into. What? You want to do that? We're just going to skip a video because it doesn't work very well on Zoom. And just to make sure that, we're already almost at 7:15 and we want to make sure we have time for any potential questions. We're just going to kind of quickly go through some of these cases. I think it just kind of once again reiterates that the fact that Eddie said we don't just do acne or Botox or something like that. So here's an example of a guy that I was consulted on when I was on doing inpatient or complex medical dermatology. He is a 65-year-old. I think he only had a history of like high blood pressure, maybe pre-diabetes. But he also had this history of a skin condition called bullous pemphigoid, which is an autoimmune skin blistering disease. Unsure how long it had been going on, but obviously it was pretty acutely worsening. He was admitted to the hospital for widespread blistering of his skin, which is pretty obvious to see here. And when I first saw him, it was encompassing about 75% of his body surface area. So these are the sorts of things that when you're in the hospital, like nobody else either knows how or really wants to deal with, so they call us to help manage it. And we have various roles, like in somebody like this, one of these complex dermatologic medical cases. So first of all, doing the biopsy of the skin, there are various techniques and ways that we do it to make these diagnoses. So that confirms the diagnosis, and also recommendations for treatment, whether that's recommending where in the hospital they go, like to the ICU, because these are basically like extensive burn patients, to wound care recommendations that we supply or that we provide to the nursing team, to giving recommendations for high dose multi-immunosuppressive regimens that a lot of other people aren't necessarily comfortable managing. Those are the sorts of things that we'll do. So anyways, we followed like patients like these basically from the time they're admitted to the hospital to the time that they're discharged. And this guy had a pretty good prognosis. His skin healed pretty significantly over the week that he was in the hospital, and he was sent to a nursing home for a temporary amount of time, and then hopefully discharged home in the near future. You're really probably only going to be dealing with things like this where you're being consulted into the hospital and stuff is if you're working for an academic institution or if you're like in residency for the most part.
And then the second and last case, this was someone that I saw just a couple of weeks ago. It was a 57-year-old male. He came in with this rash. One of the allergists called me because they thought it was an allergy to a medication that someone had prescribed, the alprazolam. Other than that medication, he wasn't on anything else. The rash he had was asymptomatic, so it was not painful, itchy, it didn't sting or burn. And they didn't do a full body skin exam. They just looked at the trunk and the upper extremities, and they thought it was drug rash. But when you look at the entire skin surface, this guy had spots on his palms, his soles, and in his like genital area. So there's only a handful of things that really affect the palms and soles, and one of them is syphilis. The other one is Rocky Mountain spotted fever, and then something that looks like this could be like a drug eruption. So after seeing this rash and talking to them some more, we had a high suspicion for syphilis or secondary syphilis. So we did a biopsy, we did a syphilis screening test, and both of which came back positive. So we treated this guy with IM benzidine penicillin G ×1, which resolved this rash within a couple weeks. So this was an easy diagnosis that could have been made visually with very minimal lab work, and that's kind of the role of a dermatologist and how they can help.
So the last thing that we wanted to talk about, so obviously Mr. Goring helped set this up, and we've worked with him a lot to kind of promote and talk about our experiences with military medicine. But he really wanted us to focus mostly on like life as a dermatology resident and our pathway here. But we still want to take a minute just to kind of give our plug for the military. This is one of our pretty, I would say, nationally renowned dermatologists who has done a lot of innovative stuff with lasers. And here he is treating somebody in our hospital setting, a soldier, and he was even featured in one of our local magazines and stuff. So this is some of the cool stuff that we get to do in the military. But like I mentioned, I did the health profession scholarship program. I applied for it in my senior year of college after I was accepted into medical school. And kind of the two reasons that I wanted to apply for it, and I assume that these are probably the two main reasons that most people apply for it, is for the financial assistance that it provides, as well as it gives you an opportunity to to serve your community and your country. And I think it has to be a combination of those two things. It definitely can't just be for the money, because there's a lot of time and opportunities and potential hardships that you might have to endure being in the military. So it has to be for a sense of service as well. The financial aspect of it is also very beneficial. So I had a full scholarship to medical school. I had a stipend to live on the whole time I was there. And then after I graduated from medical school, I would transition to active duty Army, and have been like stationed here in Fort Sam Houston and San Antonio ever since, working with at the very large hospital system that we have here.
And just lastly, for military dermatology, so 2 of the major books that we read or use and that are testable on our boards are authored by 2 of the graduates from our residency program. So one of our dermatopathology books and one of our medical dermatology books are published by them.
Yeah, military dermatology has done a lot in the field of both nationally and worldwide dermatology over the last many decades. They've contributed quite a bit.
All right. Well, I think that just about wraps it up. We have significantly fewer members now, but thank you again so much for coming and speaking with us. We really appreciated it.
Yeah, thanks for having us.
All right. Well, good luck, everybody, on your interviews and pre-med careers and all that good stuff.
Good choice.
Oh my
This
goodness.
is better.